Hello everyone, today we are ready to answer our patient most frequent questions. And thank you, Kaan, for welcoming us.
Thank you so much. It's so beautiful to welcome you in our hospital.
Hello, welcome to Istanbul Cerrahi Hospital. We will be giving you some information regarding our operations. We will talk about dental operations, hair transplant operations, plastic surgeries, and bariatric operations. Let's have a look at our hospital. This is our hair department. So we only have two operation room because we only take 4 patients in a day. So we are not dealing with too many patients. So you need to be taken care of in a very good hands. This is our Dr. Matt. He's performing our surgeries in here regarding to hair transplants. They're using mostly fouet technique or DHI technique, correct? Yes.
How does the hair transplantation procedure work?
Well, basically, hair transplant operation is we are using donor hair transplant from the backside of the hair. We remove them and we actually change their position from back to where the hair is losing. So basically, we are using grafts. We call them grafts. We change their position and we make small incisions on the front area. Let's say you lose too much weight on the front area. We make little incisions, like little holes, you can imagine. And we plant them again. So in order to do this, there are 2 different techniques. First of all, fouet technique, which is the most common one, and we have to shave total hair. So as a man, you can choose this, but as a woman, we have another technique, which we call DHI technique. So we don't have to shave total hair. So we basically shave the donor area only, which is basically the backside of the hair, and we use special pen. Let's say there's a small knife, let's say at the very end of it, and we make small incision and we collect the donor areas from the backside and we replant in the front area.
Are there any contradictions for the procedure?
No, actually. Well, I have been doing this business since 10 years now, so I never faced with complications, but we need to take serious actions. First of all, you have to do it in the hospital. According to my experience, even though it's local anesthesia, even though there might be sedation, of course, if you are scared, if you don't want to if you don't want to feel anything at all, we can use sedation. But there is no, at the end, this is an operation. We are making small cuts and there is blood. If there is blood, there might be a complication. So it has to be under very professionals, and you have to do it in the hospital. And before the operation, we have to do some consultation, like test. If you have any infection, if you have any clinical diseases, if you have like any heart problem. So before we have to check, and after that, we sterilize everything, even the materials, everything. And we have to clean everywhere. And then we can perform the surgery. Well, if you itchy them too much, you can lose the grafts. So we need to take care of them in a nice way. We have to be gentle for them. So I think the first week is extremely important. When you do your hair transplant, you shouldn't touch them because they are so new. It can be removed. So sometimes you will see people around with bandages. So these are for protecting the donor area because it's bleeding. So after the operation, we give you some special medications in order to protect from the infections. The procedure takes around 8 hours. So you might ask these questions as well. After these 8 hours, you will be under local anesthesia, but you will be swelling. So the swelling and infection risk are the most common risk. But if you perform your surgery in a very good hand in professionals, these can be solved, of course.
Thank you. How long does a patient need to stay in Istanbul after the...
Well, operation only takes around 8 hours. So we advise everyone come to Turkey 1 day before the surgery, so we can do the general checkups for you. even though it's about it's related with the hair, but we can check everything, even the lungs. Maybe you are allergic to something, you're allergic to medicines that we are using. So it's way safer to arrive 1 day before the surgery. So the surgery, so after the surgery you have to stay 2 more days. So in total, I guess 3 up to 4 days will be enough for hair transplant.
Very short. And
yeah, it's very short, very clean.
How long does the recovery period take?
Well, full recovery time is all up to one week. So you will feel more fresh after the hair transplant operation, because as you can imagine, we are giving small local anesthesia around your hair. You will feel a little heavy after the operation. This swellness will go away after 4 days, and you can go back to your life actually day after the surgery. But it will look a little bit, little dirty, little blood maybe coming out from your hair. So give yourself 1 week maximum, and maybe you can go back to your real life and after 1 week later.
Amazing. Is there any difference between hair transplantation for men and for women?
There is no, actually. So I told before that there's 2 techniques, the fouet, which we have to shave total hair, and there's another technique which is way shorter, the HI technique. We are mostly using for eyes, for eyebrows, and for the forehead reduction operation, because sometimes people have like a wide front hair. They say we need to plant some more hairs in here, so we choose this operation. As a woman, as you can understand and imagine, it's a little bit awkward to have like a braid.
I want to be bald.
Yes, exactly. So that's why we are using the HI technique, and we are not shaving at all. The recovery time is way faster than the fouet, and you don't have to wait for growing hairs again. So there is no difference, but we are using different techniques.
Can you replace brows totally? For example, if the person has no brows at all?
Yes, we can plant. We can again use your deltoid area, which is from the back of the head. We remove these grafts, and we can plant them in the eyebrow areas. We are mostly doing this. Every day we have 2 or 3 women in here. They are doing the eyebrow operation.
Welcome back. We have 2 different alternative rooms for our patients. We provide them suite or big size of rooms. It depends how you need. If you come with your family, we can provide you suite rooms, which has 2 rooms and 1 bathroom. So this is basically one of the standard rooms we have. In each level, we have 9 rooms in here. We have special crew. They are waiting and they are ready for any emergency case. As I told you, this is a full capacity hospital. If there's any emergency case, if you feel bad, if you don't feel well, you can call the general surgeon, brain surgeon, neurology department. Everyone is ready for you.
What services do you offer in the field of aesthetic?
Plastic surgery.
No, dentistry. Aesthetic.
Aesthetic. Okay, we mostly welcome our patients in here for emacs, for crowns, for implants. We only use German products, by the way. We don't use local products, because this is FDA approved implants. So most of our patients coming from all over the world. So we organize everything in once. So we know that they can't travel too much. Okay, so once they come in here, we advise them to stay in here at least 2 weeks. So we calculate and measure everything regarding to the teeth. The day after they arrive, we do consultation. We tell them what they need. Sometimes they need canal cleaning again. Maybe they're coming for some. For example, I used to have crossed teeth. So there are 2 alternative ways to fix it. The implants, the veneers, crowns. It's all depend on your budget, or depends on how you want them to look like. Okay. If you use already one, we serve them implants. But if you're only bothered by the color, or if you're bothered by the size for the lungs, we use veneers or either crowns or either the implants.
So you decide according to every
Exactly.
patient.
This is so individual issues. So it depends on the people. Sometimes we use orthodontic technique. So we advise them different alternative options. So we are deciding together with the patient.
There is opinion in the internet that medicine in Turkey, and dentistry as well, is cheaper than in Europe or in the USA because of bad products?
Oh yeah, this is totally wrong. Actually, they can use. It depends on the doctor. It depends on the quality. As this hospital, as a manager in here, we only use American product or German products, and well, there is a fixed price of this. Of course, the implant has a cost, and it's way cheaper than Europe because when we buy any implants from Europe, we buy everything at once. So and you know, currency issue, and there are doctors too many in here, so we are serving way cheaper than Europe. I had a patient yesterday. We fully replaced everything: teeth, 5 implants, around 25 veneers. It cost way half price on what she had before. In Switzerland, she asked for they asked her to pay around 50,000 something. It's too much, and she paid only half in here.
Yeah, using the same quality.
Exactly, we are using same materials, but in here we have too many options. There are too many alternative products, and the currency issue is the most important thing in here. So still, Turkey is leading the dental operation.
Thanks, Turkey, for that. What guarantee do you offer for dental implants, crowns?
Well, we mostly give them a lifetime guarantee, but this is eventually a mouse, so we don't know how you're using. One of my patients used, I think he bite a rope or something. He broke again. Yeah. It's not related to that, right? We can guarantee that, but most of our patients, they're not coming back for any dental problems. If they have need one, they are coming. Of course, they're choosing over and over again. So basically, we don't do any advertisement, so they are referring again and again. But we mostly, the products has 5 up to 7 years guarantee, and after that, due to the condition how you're using your teeth, I don't know if you brush them in a good way. It depends on how you take care of them actually, but they will give you 5 up to 10 years guarantee.
How much time is required for the installation of veneers?
Oh, okay. We need a full 2 weeks actually. Normally, we tell them, give yourself 1 week, because there are too many techniques in here. We are using AR right now, and artificial intelligence giving us a very good and exactly veneers shape. So the day after the patient arrives, we call them, and we are using artificial intelligence and to calculate and measure it, everything. We send those products immediately into our laboratory, and 1 week later we finish everything. But in advance, sometimes they need implants, sometimes they need vaccination, they need some things which we can't see up front. So basically we tell them 2 weeks, give yourself 2 weeks.
Very interesting, you told about artificial intelligence. Yeah. For what else do you use it?
We use artificial intelligence for, sometimes we have XR, we are doing MRI products in here, but recently, last 2 years, there are new techniques. We are doing 3D technology to see what's going on inside of the mouth. So sometimes patients, I respect them. In their countries, they don't have this technology, or it's too much expensive. In UK, for example, it costs around £1,000 or something. But we only charge them in here maybe around 200, I don't know. It's way cheaper. And they basically send their mouth picture. Because we say, okay, we understand you might need veneers or the implants coming here. So day after they arrive in here, we send them XR and MR. And then we have special machine in here, which is taking the special photos of the teeth. And we use some technology to agree on which technique we are going to use, how many implants or how many veneers we are going to use, and it gives only limited time to decide. For example, for us, it says this patient needs only 3 days. Normally, before 10 years later, 5 years later, patient's supposed to come 2 times, 3 times. First they come, we measure them, and we decide together, they go back to their country. It's too long. Now with the technology, when we give them the picture, even the picture, the artificial intelligence decide how many veneers you need in order to reach the maximum good look.
Mm-hmm. How do you track the patient after?
Oh, we have special crew for this. After the surgery, we have special team in here, like 5 people, calling them if they're having trouble. You know, whatever you do as a plastic surgery, dental, hair, you need to follow up. Maybe you might have an infection. This is operation at the end, or you bite something wrong, maybe something tough, and you might broke it. Okay, this is not related to operation. But every week we are calling all of our patients and we are saying, well, are you okay? Do you need anything? Or are you having a trouble with having these? Maybe they have infection. So we call them, we type them. If they have any problem, we call them immediately in here. If they need support, we are providing them.
Okay, let me show you another room of us. This is another typical room. This is for only short stay. Let's say if you've done breast augmentation or rhinoplasty, and you can only stay one night and you can go back to your hotel. And only for controls we are calling back to our patients. We are very, very located in very central city of Istanbul. You can reach the Bosphorus in 5 minutes by walking, and you can go to Nişantaşı. It's a very fancy place, like it takes only 10 minutes by walking.
What kind of plastic aesthetic surgeries do you perform here?
We perform too many things in here. Basically, let's start with breast implants. Sometimes people are applying for breast augmentation. I do respect, and what does it mean? I do respect. Yeah, sometimes. So they must become for breast augmentation. We have a good aesthetic department. If they want to choose female doctor only, we go with the female plastic surgeon. Sometimes they choose men. So we only use mentor implants, by the way. This is FDA approved implants and they give lifetime guarantee. It's so important. By the time some patients are coming, they say, we want to change again. So it's so important for us to know what is inside of the breast. So sometimes people are using very alternative brands, which we don't know. And if they approve it, maybe it's not, so we don't know. But if they come with the certificate, so we know what is inside, okay? They must be coming for breast augmentation. It's so easy operation. It only takes 45 minutes to implant the breast implants. The augmentation only takes 1 night and staying in the hospital. It's very easy. We decide all together with the patient. They come sometimes, even though they have enough tissue, they say like, I want to go higher, a bit bigger. And we say we can go with 300 cc, 400 cc, up to 800 cc even. So it depends on how you want to look like. Sometimes women patients coming, I'm wearing my dresses, but I'm not pulling the top side. They say we go with implants. Sometimes after giving birth, and especially our women are giving the breastfeeding, the breast tissue is going down a little bit shaking. In order to make them up, we are using implants or breast lifting technique. So we can do it in everything at once. It's easy operation again. For the any breast augmentation or lifting operation, the patient's supposed to stay in hospital only 1 day. It's very easy. And after the operation, 7 up to 8 nights in the hotel will be enough. After the operation, I will be honest with you, it's a little bit painful, but we are giving enough medication to all our patients. Painkillers, antibiotics, and we are giving special cream for the incisions, because sometimes people are wondering about the incision scar, how it's gonna look like. And we are giving all the medication. After the surgery, they can immediately walk. After 4 hours later, most of our patients, I said them in the cafe, they're sitting with the friends. It's easy. It's the most common operation when we think about all plastic surgery operations. The breast lifting and breast augmentation. What we do liposuction operations. This is sometimes there's a misunderstanding about liposuction operation. People are sometimes seeing this as a losing weight operation. Basically, this is not a losing operation. We resculpt the body actually. We remove extra skin. For example, think about me. I have little weight in here, the sides. Doesn't matter how long I go to gym, I can't get rid of the sides. This is like bothering me. But the only way of getting rid of this is either you have to live in a gym or you have to come for liposuction operation. There are too many techniques. Maybe patients are wondering which one is good, which one is better. Let me tell them, liposuction can be done with Hercules, can be done with laser operation, or we can use lipomatic machine. These are only machines and techniques, and basically they are working in the same principle. They are like, we remove the fat. First, we give a little bit serum, let's say liquid inside of the body, which is mixing with fats and bloods, and we remove them. So after removing these liposuction fat tissues inside of the body, any parts of the body, it can be arm, it can be abdominal area, it can be leg, it can be butt area, or for the back as well. So this shagging part can be appear after this. So we are using two different techniques. One of them is plasma technology. There is argon plasma, G plasma. These are the brands, but basically plasma technology is recently using by any plastic surgeons in Istanbul or any around the world. It's so famous. So we don't have to cut you. We don't have to do the incisions, like large incisions. We don't have to do it. So if you're suitable for this operation, we basically using the same incision area to go with argon plasma, the cannula, which is burning the skin inside. Imagine like burning the skin, so it's tightening. So we don't have to give you very big scar, which can be shamed, right? So most of the women are chasing for this argon plasma, but if you lose too much weight, if you done gastric sleeve operation before, and if you lose, let's say 50 kilogram, then we can do a tummy tuck operation. Tummy tuck is basically after giving birth or after losing too much weight, over than 30 or like 40, 50 kilograms. And imagine this is like a balloon. When you fulfill the balloon, it goes big, right? Mm-hmm. But we lose the air, there is extra, okay? So we have to cut the extra skin. We pull down the skin, we remove the extra part, and we do the stitches. While we're doing this, we fix the abs as well, okay? So it will give you glass hour shape. This is the most common technique that we are using. Well, tummy tuck and arm lift, as I said before, after giving birth, or like if you gain too much weight and you lose it, there might be excess skin in here, which is bothering you when you're wearing, let's say, good, beautiful dress. Or if you go to seaside and during the summertime, you can feel like there's too much extra. We can use argon plasma, but if it's too much skin, then we have to do lifting operation. Well, after the tummy tuck or arm lift operation, there will be a scar, I will be honest with you. But we have too many techniques that it can be removed. It depends on your skin quality, actually. But we have too many alternative techniques. It can be like laser, or like giving good creams, taking care. So it's half of you responsible, half of us. So if you take
every surgery.
Exactly, so there's like a both sides. Arm lifting. Oh, there might be a leg lifting operation. Again, after losing too much weight. There might be lipodemia problem, you might have it. Recently, we are facing with too many cases. Lipodemia is like basically the leg is getting bigger and it looks like orange in like waves and layers. And it can be fixed with liposuction operation and lifting operation. Beside these, we have face operations, cat eye operation, full face, and we have new technique, deep plane face lipo operation. And I will be honest with you, it's giving maybe 10 years to you. Like I had patients last week, she was 65, and I saw her today, she looked like 40s. I was like, oh, you look
more than 20 years.
Exactly. So basically we are removing the extra skin. By the time when we get older, and there is gravity, and then we are losing our skin to the down position, right? So we basically pull them up and remove the extra skin. While doing this operation, we do lower blepharoplasty or upper blepharoplasty. When we combine these three, face, neck, and blepharoplasty, it looks very good. I suggest them all. And beside these, we have, as I told you, fat injection operations. For example, when we do liposuction operation, we have fat. These are very, very important things. It can be used for transferring to breast, or into the hands, or in the face and hands, and it can be used by BBL operation. Brazilian butt lift is the most common operation recently since 5 years now. And we are basically using, if you don't have any too much big butt area, we are using those fats. We do 360 liposuction. We collect, let's say, 1000 cc, and we inject them into the butt area. And it looks really, really nice. And the recovery time is too fast. And you can only give yourself 10 days in Turkey, 2 nights in the hospital, or like 1 night in the hospital. You can have a look at in beautiful Bosphorus, and you can visit, do shopping. It's so cheap. And you can go back to your country with a beautiful body.
Which plastic surgery is considered the most difficult for the patient, and which is the easiest one?
Breast augmentation is the easiest one. It takes only 45 minutes. It's easy for everyone. They come, they arrive, we put the implants, they wake up in a very smiley face because they're like, oh my God, what are these? And then 5 days later, 6 days later, they can go back to their country. It's very easy. But I have to tell you this, wearing corset is the most important thing because it gives you the good shape. But if you don't wear the corset, it might be bruises and edemas, okay? The most difficult one, I think, the tummy tuck one. But it's not, when I say difficult, it's difficult for not for you, but for the operators, okay? Because we, as a hospital, we do too much care of this operation. It takes 4 or 5 hour operation. It depends on the patient. It might be too big, and we have to do the stitches in a very, very, attention. We have to do attention to this because these scars will stay with you like forever, right? So these stitches supposed to be in a very good, like the tailor is doing. So we call our surgeons like a tailor in a way, because if these stitches are not good, it will not look well. So before you choose your operator, you have to tell them how do you do your stitches. How long do you give yourself to do this? Are you fixing it on my abs as well? So these are like very important things to follow up. But tummy tuck, yes, I will be honest with you, it's hard operation, but it is painful operation. But we are taking our responsibility, and we give them painkillers, all necessary the medications will be given. When I see my patients after the operation, they say, "Khan, I'm okay. I feel okay," because they see we show them their pictures. This is how we look like. They say, "I'm too happy. It's hurting a little bit. It's worth it." So after the operation, we tell them to walk because we need blood circulation. And then 2 days later, we send them their hotel, and we tell them go to shopping because you need to walk, okay? You don't have to do the shopping, but you have to walk. So tell them, okay, take your husband and go to the shopping, or like an impactor. So tummy tuck, I can say the hard one. The breast augmentation is the easy one.
Okay. And a lot of patients are interested when they can take a shower after this.
We suggest them 2 weeks later or 1.5 later. It depends on...
Take a shower 2 weeks later?
Yes, it's too much.
2 weeks without...
I don't know.
Just a question.
Yeah, we don't suggest them too much because actually... This is incision. There is blood. I don't know, how do you take care of yourself? After getting wet, you need to clear them, and you need to get dry in a very good way. You need to protect this incision area. So we negotiate together. If you promise that you're going to take care of yourself, if you're going to get dry, if you use your bandages on your own, if you have any partner, then you can take a shower after a week, sure. But if you're in... let's say if you're on your own, and if you're not taking too much care of yourself, then we say, okay, let them heal, and then you can take a shower.
Okay, 2 weeks after tummy tuck.
Exactly.
And if we talk about breast augmentation.
Breast augmentation 1 week later will be enough. 1 week.
Amazing.
Yeah.
Thank you. Sometimes a patient wants to make several surgeries together.
Combine operation.
Yes. What can you combine?
We can combine tummy tuck with breast lifting, arm lifting with tummy tuck, leg lifting with breast lifting or breast augmentation. Well, basically, I'm thinking on the behalf of you, because when we do operation on the legs, it's a little bit hard for you to walk, right? Because you're going to use them. So when we touch the leg, we don't want to touch the arms. When we touch the tummy area, we don't want to touch the legs. So it can be combined with tummy tuck with arm lifting, for example, or arm lifting with breast augmentation. So you can use your legs, and it can be done with liposuction. BBL with tummy tuck could be hard little bit, for example. Why? Because we inject the fat in the butt area, right? When you sleep on it, we give you special pillow. But if you don't use it, then the liquids, the fat can be disorientated, like the shape will not be good. So let's fix the surface up front again, and then after that we can go back to the back side. So mostly I suggest do the BBL or breast augmentation together, or tummy tuck with, let's say, arm lifting. But if we go with BBL operation, let's stay with BBL, maybe liposuction, total body.
And in that case, what is included in mommy makeover?
Oh, we including tummy tuck, breast lifting with implants. If the patient wants, we can do vaginoplasty. As you can know, after the giving birth, that area can be open too wide, and that might be losing a sensation like feeling. So we fix those areas. So mostly we include tummy tuck with 360 liposuction with breast lifting. If it's necessary, we put implants as well.
After what time the mom can make a makeover after giving birth?
Oh, we say minimum after 1 year later. So feed your baby whenever you feel okay, when you feel ready. The body needs time after giving birth, right? So after 1 year later, the body starts to feel okay, and the edemas goes away, and you almost stop breastfeeding, and then you can come to do your operation. But there is a special case. If you, after the giving birth, if you stop breastfeeding after, let's say, 3 months later, you can come on the 8 months. So minimum is 1 year, let's say.
You mentioned facelift surgery.
Yes.
How much time the patient need for recovering?
For recovery, first week is extremely important. We suggest them to stay in the hospital 2 nights minimum, and give them yourself time like 1 week staying in Turkey. 10 days will be better, because recently we are not using mask anymore because there are too many new techniques. We know that wearing corset for the face is bothering people, and they don't want to go around with this. So we are changing our techniques right now, and full recovery time, it's taking 1 month. So the edemas and bruises will go away after 1 month, I guess.
After facelift surgery, patient has significant changes.
After what surgery?
Facelift.
Facelift, yeah.
Yes, significant changes, and there can be some problems in the costumes. Like, look at the one photo, and there is 20 years.
Yes, that's funny. Yeah, we mostly say. Once I had a patient 2 years ago, I guess. She was from United States, and we done facelift operation. When she reached the airport, they said this is totally something new one, so you need to change your picture. So there is too much change. There's a big
Do you provide any documents of
Of course. We give, as a hospital, we do give them special paper regarding to their operation. We give them a paper and say this patient performed facelift operation. We perform this, and they take this hour. We give these special medications. She stays, let's say, two nights in the hospital. And we give a special paper for everyone. Not for facelift, but for all operations. We provide them a paper regarding the operation.
Okay, thank you.
In breast augmentation operations, we have different alternatives. Depends on how big you want. Okay, these are the implants, and you can't actually damage them. Some people are asking if there can be something goes wrong, it can be ripped, or it goes dangerous. No, it can't. Basically, you can't do anything at all. These are very tough material, and it's soft. So this is the smallest one, 250 cc's. And if you want to go bigger, there are bigger versions, and there are very alternative types. We are using mentor implants only. It goes up to 860. This is the recently B-Lights. This is the most soft ones if you want to teach and feel the softy ones. It depends on you. How do you want them to look like? If you're looking for a big one, you can go with 800 cc even, which is too big. We mostly using 300 cc or 400 cc, or the smallest one, 225 cc's are most common used implants.
Yeah. And the last part, it's bariatric. What type of bariatric surgery do you perform?
We perform gastric sleeve operation. This is the basic one. If your BMI is over than 35, we can perform gastric sleeve operation. Basically, it is 1.5 hours it's taking, and you only stay in the Turkey 5 days. And after the operation, after 4 hours later, you can walk. You feel like you can go around, and you can start eating water even a little bit. And well, there's a funny thing about this gastric sleeve operation. They say, am I gonna lose my appetite? Am I gonna be able to eat again? Yes, of course you're gonna eat again, but you're not gonna feel, because while doing gastric sleeve operation, we remove maybe half of the tongue. Okay, the area, sleeve area. So when we cut the tummy, the half of it, you don't feel too much hungry. This is all about your psychology. You feel like I need to eat, but you don't have to. So after the operation, we tell them to have protein shake, because you're not going to eat that much as you used to, but your body index is still like you're big, and you feel like I'm not energetic enough. So we give them special medications, like protein shakes, like special medications, and then you can feel energetic again. There is another technique which we call bypass operation, or slim revision operation, or like mini gastric bypass operation. All of these three can be performed to any patient, but we mostly perform normal gastric sleeve operation. Bariatric bypass operation can be only performed to those patients who already done operation and they couldn't able to lose weight. Maybe some operation goes wrong, I don't know. Maybe the doctor didn't perform well, I don't know. But sometimes people are applying, they say, I done a gastric sleeve operation 2 years ago, but I couldn't lose too much weight. What should I do? So then we tell them to do revision operation or bypass operation.
What surgeries patient can do after bariatric surgery after 1 year when he...
Oh, great question. Most of our patients as I told you before, we are following up our patients. When you do, for example, gastric sleeve operation, we know that there will be shagging part after the operation, right? Let's say tummy area, abdominal area. After the gastric sleeve operation, our patient mostly losing 30 kilograms, 50 kilograms, 70 kilograms even. It depends on how big you were before. Let's say I had a patient 200 kilograms and he lost around 100 maybe, I don't know, and he's keep losing. So we follow up them. Let's say done a gastric sleeve operation and I lose, let's say 150 kilograms and I reach my maximum level, 50 kilograms, which is too much, okay? So we are following our patient. We call them, are you fixed? Are you stabilized? And you're not losing anymore, or you're not gaining anymore. Okay, there are some limits. If he loses too much, or if she loses too much, we said we have to eat. You have to stop medication. And when they reach their maximum and normal level, and we call them, how do you look like? So they send some pictures, like tummy area mostly shaking, or like leg area, arm lifting operation, especially breast augmentation it needs, because these are tissues as well. So when you lose weight on the breast area as well. It can be like backside. Sometimes our patients are asking 360 lifting, because there is another person coming up out of you, right? You're losing 100 kilograms. So first of all, tummy tuck operation, abdominoplasty. Second, arm lifting operation. Third, leg lifting operation. Sometimes people are losing too much fat from the face. Maybe they need leg lifting and face lifting even.
Mm-hmm. Depends on the patient.
Depends on the patient.